one anastomosis gastric bypass or the mini-gastric bypass are the second most common weight loss surgery done on the planet Earth. It's not the second most common done in the United States, but it is the second most common done in the world. And the reason is that there were some issues in the United States, probably mostly political, between the person who invented that procedure and some people who followed it, but it got taken overseas and it has exploded. And one of the reasons that it is such a good procedure is it gives a standardization to how long we make the limbs, how long we make the stomach, all these technical surgical things. And it avoids one of the major complications that can occur with the Roux-en-Y gastric bypass. So we will have patients coming to us just because they've read about this, they've decided that because of the unique features of it, they want to have that surgery. And we have an amazing amount of experience with this. So sometimes you'll hear it called the mini-gastric bypass, sometimes you'll hear it called the one anastomosis gastric bypass. Essentially what it is we take the stomach and again partition the stomach in two parts, and we have a little diagram. And after we partition the stomach in two parts, the upper part, we now take a bit of bowel and we bring it right up to the upper part and suture it in there. And that's it. It allows you to have a little more food than the Roux-en-Y gastric bypass, so you're more comfortable after the surgery, and has a little bit more malabsorption than the typical Roux-en-Y gastric bypass. This is an operation that insurances typically don't cover. So it turns out that it's one of the operations we offer on the fast track, and oddly enough, because of the hospital has given us a great value on it, it's probably one of the least expensive operations that we offer for those patients who are looking for weight loss surgery but don't have insurance. Other places this operation is used at is as a secondary operation for the gastric sleeve. So you know the gastric sleeve, we've already made our sleeve. We just cut the stomach in half, bring up a loop of bowel, and that allows the sleeve for those patients that the sleeve hasn't been optimal for. It provides them with more weight loss or getting back on track. So remember, weight loss surgery is this balancing act that surgeons take with patients. Patients will say, I want the most aggressive operation, but that may not be the best operation for you. And so our goal is to find the operation that's right for you, or if your operation didn't work, find the best way that we can revise that operation for you so that you can get back on your weight loss journey, so that you can have that life that you deserved and were meant to have. So if you want to, fill out the contact form, give our office a call, or you can even email me personally, and we'll get you on this journey. This journey to get you back to the life that you deserve.